Dobra večer, colleghi. The only thing I can say in your language. It's a real pleasure to be here, and I thank the company to invited me to give this lecture. We work very much, a lot of time, and we were able to do some studies in this field. So I will share with you today my experience on this product, Epigallocatekin gallate. Is a prostate protector of new generation. This compound is very important because it does affect the carcinogenesis. Carcinogenesis, in order to understand this, we need to know something about, a little bit about carcinogenesis. We know that it's a multi-step process characterized by genetic alterations that disrupt the regulatory circuit controlling cellular proliferation, apoptosis, and differentiation. In most epithelial tissues, genetic progression and loss of cellular control were observed. What happens in the prostate? In the prostate, the cell and tissue phenotype changes from normal to dysplasia the first time, and we have PIN, prostatic intraepithelial neoplasia, and then to severe dysplasia, which is high-grade PIN. Then we have superficial microscopic cancer, and finally, invasive cancer. This is a cartoon showing you the normal prostate, normal epithelial cell, then the inflammatory atrophy, and PIN and prostate cancer. This is a cartoon from Kirby. Very interesting because showing that we have genetic changes one by one passing through normal cell to high-grade PIN to microscopic prostate cancer, locally invasive prostate cancer, and, metastatic prostate cancer. So these changes, we need to know that occur over a long period of time. In prostate, PIN develops over approximately 20 years, so we have time to act. And progression from PIN to high-grade PIN and early prostate cancer may take 10 years or more. That's very important because if you have a long period of time, we can interfere in this process. And so it would be extremely important to interrupt this process before cancer development. And this interruption, we can stop the process using chemoprevention, which is the administration of natural or synthetic agents to reverse, inhibit, slow, or even prevent. This is a very magic word. Prevention will be the future in urology, I think. We can prevent the development of cancer. And catechins, among the others, are the most important chemopreventing agents. Mm-hmm. And here come our epigallocatechins, because catechin has been found in the green tea infusion, and there are 4 important compounds. One is epigallocatekin 3-gallate, the second is epigallocatekin, epicatekin 3-gallate, and epicatekin. And however, the most important one and the most potent chemopreventive agent is epigallocatekin gallate, which we are discussing about today. These are the compound you can see, it's just to let you know, and this is epigallocatekin gallate. And why green tea? Because in China they studied a lot the green tea in humans. And we have epidemiological studies. And there is a case control study which has been conducted in 2001-2002 And in these studies, these patients were taking green tea high dose, and they observed at the end of the study that the patient who received green tea developed less prostate cancer than the other control. So this was very important because it was a dose-response relationship. This was published in International Journal of Cancer in 2004. So after this, we started our program. These are the leaves, just to let you know. These are the culturing, the green tea, and this is what we drink. And the mechanism of action. What is the mechanism of action? It actually is not really known. However, Kumar from United States studied a lot of this compound and found that Epigallocatekin gallate potently and selectively inhibits the proteasomal chymotrypsin-like activities, and what is doing is leading to grow the arrest. In simple word, Epigallocatekin gallate stop the growth of prostate cancer. So we could think that probably this studies, there are few studies in this field. However, it's not like this, because the NCI, the National Cancer Institute in the United States, for instance, is spending a lot of money studying this agent. In fact, they are currently sponsoring 20 studies. And if you think that one study cost $4 million, $5 million, you can understand that the research in this field is much more important than we think. And they have different types of studies, as you can read there, and they tested many different drugs. And between these drugs, also catechins is being studied, and is studied because there is a study not yet finished. Now I come to my personal experience. And my personal experience started in 2000 in a translational research program we had in Modena. And the objectives of this program was to evaluate the efficacy of green tea catechins as chemopreventing agent in prostate cancer. We were 7 institutions altogether with pathologists and statisticians, and we started in 2000. And we started with an in vitro study. We just in the lab. We used Epigallocatekin gallate, and we put this compound near a cell line, a 2 type of cell line, and we were able to show that Epigallocatekin gallate can stop the growth of 2 cell lines, important prostate cancer cell lines. And this was impressed in Oncogene 2002. Then we passed through an animal study, and we select a transgenic prostate cancer in mouse. We select a mouse in which prostate cancer is growing naturally. So we administer orally to these mice catechins in drinking water, and only water in a control group. So we had 2 groups of mice. One was taking catechins, Epigallocatekins, and the other one was drinking only water. And these trumps had prostate cancer. And the result was that oral administration of catechins reduced prostate cancer incidence at 24 weeks from 100% to 20% without side effects. And we thought that the reason was an overexpression of clusterin, which is a gene. Then we passed to human. So we went from vitro, animals, and human. This was a phase 2 study. It was double-blind, placebo control in patients with high-grade PIN, because high-grade PIN is thought to be a precursor of cancer. And the eligibility criteria were age from 45 to 75, patient having high-grade PIN diagnosed after 18 course biopsies according to prostate volume, and we were able to recruit 60 men with high-grade PIN, which were randomized to receive 600 milligram a day, three capsules of catechins versus 3 capsules of placebo. I must say that also urologist who was giving the capsule didn't know if he was giving the drug or placebo, was completely blind. And I must say also that 3 capsules of this drug were equivalent to 20 caps of tea, of green tea. So high dose. Let's go to the content of the capsule. You can see 52% of epigallocatechenes, and in total, catechins were present in 76% of the compound, while caffeine was reduced to less than 1% in order to reduce the side effects. The primary endpoint of our study was the prevalence of prostate cancer during the first-year study in both arms, and the secondary endpoint was PSA changes, IPSS, and quality of life variation. We follow up our patient every 3 months with PSA, digital rectal examination, EPSS, and quality of life, and we did a prostate mapping in all the patients after 6 months of treatment. Then we did as prostate biopsies in case of increasing PSA or in any case of suspicious digital rectal examination. These are the results. After 1 year, 1 patient had prostate cancer out of 30 who received the gallocatechins, 3%, versus 9 patients who developed prostate cancer treated with placebo only. The difference was huge. So the PSA was no difference between 2 arms. So the catechins do not affect PSA. But EPSS and quality of life improved in the group of patients receiving catechins. So our conclusion was, and it was published, high-dose catechins was effective in reducing the prevalence of prostate cancer in men with high-grade PIN. High-dose green tea has a potent chemoprevention activity for human prostate cancer and is safe. PSA was not affected, and IPSS was improved. Then we posed ourselves a question: what happens in the future if we give 1 year of therapy to this patient? What happens if you stop treatment and we control this patient? And that is the result of this study we published in European Urology 2008. And patients were followed in time, and the mean follow-up in the placebo arm was about 2 years, and the catechin arm was 19 months. And the results were the same, because we found 2 more patients developing prostate cancer in the placebo arm, with a total of 11, and 1 patient in the catechin arm, for a total of 2. So our conclusion, they demonstrate a final difference in prostate cancer prevalence that was highly significant, for a p-value of less than 0.01. So this drug, this compound, is acting also in the long time. Conclusion: the inhibition of prostate cancer progression is long-lasting, and the early emergence of benefit at 6-12 months suggests a treatment effect on early lesions. Catechins determined an almost 80% reduction in prostate cancer diagnosis, but larger randomized trials are needed to confirm our result. Of course, when we came out. With this result, we went to the States because we were invited, and in the States, they mounted a trial, which is exactly the trial I designed and tried to do it. However, in my mind, it was a doubt. Is it that only one single compound is effective? Or what happened if we mixed this compound, this trace element, dietary factors? And for this reason, I tried to have an answer from a pilot study. So I designed this study, which was prospective, evaluating the efficacy of 7 agents in combination. Not only catechins, but also genistein coming from soy. Soy is very important. Lycopene, vitamin E, D3, selenium, and zinc. And I recruited 40 patients with a mean age of 58.7 years, with a mean PSA, look, 8.5. So, young patient with high PSA. And this patient received 1 to 4 sets of biopsies. So we excluded prostate cancer in these patients. So if you have a patient less than 60 and he has 8.5 of PSA and the negative biopsy, what you do in these patients? Nothing, and then you do again another biopsies. So we treat this patient with these factors, dietary factors, and 22 of them receive 40-80 milligram a day, while 18 patients receive 960 milligram. And the result, after a follow-up, and then I followed this patient for more than 8 years. So what happened to a patient like this after 8 years? It's interesting, I think. And it happens that 60% of them had a reduction in PSA. The majority, if you give catechins, you give this drug, the PSA is reduced. 16% had stable PSA, and only 24% has a PSA increase. And the mean PSA reduction was 2.9 in patient receiving 960 milligram, high dose, while it was only 1.3 nanogram in patient receiving 480. No side effect was seen. And I think the last sentence is very important. How many patients develop prostate cancer? Only 2 patients, 0.2%. So if you have a patient like this and you give this chemopreventive agent with catechins, you can tell him that the chance of developing cancer is very, very low. My conclusion was the combination of soy, lycopene, catechins, and vitamin can reduce PSA in 60% of young patients at risk, and 960 milligrams were more effective than 480. So if you do it, you have to give three tablets, not 1. And my conclusion, we can say that chemoprevention for prostate cancer is a widely accepted concept within the population because, we had no problem in convincing patients to participate in the study. They were very, very keen to do it. Dietary factors and catechins are a very promising group of compounds, even if their mode of action is not completely understood. Due to cost and side effects, I favor studies using these substances more than, other drugs like estrogen or something like this. The question if a single chemopreventive agent is better than a combination of substances has not been answered yet. High-dose green tea and epigallocatekin gallate showed efficacy in reducing the risk of prostate cancer from high-grade PIN in the long-term period and needs a large phase 2-3 study to be confirmed. And with this slide, which is the first racing car from Ferrari, because I'm coming from Modena, where the Ferrari team is, I thank you very much for your attention. This is the brand new, not the new one, but a very good Ferrari. And I thank you very much for your attention.